Good afternoon to all of you. Happy Friday to everyone. We are happy to welcome you on our third webinar for 2022. I am Dainty Maydia Biera, Business Relationship Manager of Generali Philippines, and I will be your host for today's webinar. Cancer is one of the most dreaded diseases in today's world. The most common cancers are breast, lung, colorectal, liver, and prostate. Having cancer changes your life and the lives of those around you. The symptoms and side effects of the disease and its treatment may cause certain physical changes, but they can also affect the way you feel and how you live. The main aim of this webinar is to know more about cancer, its causes, prevention, and treatment, to help you cope with the many issues and concerns that occur when you have cancer. There are resources available to help you learn about your diseases and about the people who can help you. And for you to know, you can help your employees on the event they were diagnosed with cancer. Before we start with our session today, we have prepared a little game for all of you. First, to type in the chat box, the correct answer will receive 500 pesos worth of Grab voucher. Are you all ready? For the first question, what are the common types of cancer among Filipino women? A, breast, lung, ovary. B, breast, leukemia, ovary. C, cervix, uteri, leukemia, colorectum. And D, leukemia, liver, lung. And the correct answer is letter A. So the winner is Miss Ethel. For the next question, what are the common types of cancer among Filipino men? A, lung, bone, prostate, B, bone, colorectum, skin, C, prostate, lung, liver, D, bladder, lung, colorectum. And the correct answer is letter C. And the second winner is Mr. Ricky Gumaru. To Miss Ethel and Mr. Ricky, will reach out to you directly to claim your prizes. Thank you for your participation. We have another set of questions after the talk of our guest speaker. So this webinar is in cooperation with Home Healthcare, premium provider of health and wellness programs. We have a few reminders before we start our program. We will put everyone on mute mode so that we can hear our speaker clearly during her talking segment. If you want to engage with us, just send a message through the chat box below your screen. Feel free to write down your questions for our speaker. The live Q&A box is open throughout the talk. You can type your listed questions there and we will do our best to answer it during the Q&A segment. So without further ado, let's begin our program. Our speaker for today specializes in internal medicine and oncology. She obtained her fellowship and residency training in St. Luke's Medical Center, Taguig, Global City. She is a fellow of Philippine College of Physicians and diplomate of Philippine Society of Medical Oncology. She has worked at Associates Health Clinic and Health and Wellness Center in St. Luke's Medical Center. Let us welcome on our screen Dr. Cristina Domingo.
Hi everyone, good afternoon. Good afternoon, Ma'am Dainty.
Yes, good afternoon, Doc. Good afternoon, everyone.
Can I share my screen? Wait, let me share my screen. There. Can everyone see my screen? Okay, let's start. So good day, everyone. I am Dr. Cristina Domingo, or you can call me Dr. Ana for short. Today, we will be having a short lecture about cancer, an overview. So I will be as straight to the point as I can, because it's already almost the weekend. So let's get started. So today's agenda, these are the points that we will tackle. Definition of terms, Philippine data, signs and symptoms to watch out for, causes of cancer, screening and prevention, treatment options, and some supportive measures. So before we start, who here knows anyone with cancer? Do you have a relative, a friend, or friend of a friend who is diagnosed to have cancer? I'm sure some, if not all of us, know someone who has cancer. But first, what is cancer? Do you guys have any idea what cancer is? Okay. So basically, cancer is an abnormal, meaning not normal, uncontrollable, cannot be stopped, and continuous replication or division of cells, which ultimately become a tumor or bukol. As you can see on the photo on the left and the right sides have orange and purple cells. These are the normal cells. All the cells look the same, almost uniform. They are organized and lined up very nicely. So in our body, cells are supposed to look like this, organized and lined up. Now compare them to the cancer cells in the middle. These are the blue cells. So as you can see, they are different shapes and sizes. They are not organized. They are stacked unevenly. And they are actually causing tension or stress to the normal cells around them. Other characteristics of cancer include organ invasion and spread to distant body parts. In this photo, the normal cells on the left are organized. There is no invasion of the barrier colored in dark brown. If we compare this to the cancer cells in the right, the cancer cells are the ones colored in gray. They are really organized, they are not lined up, and there is invasion of the barrier. So to keep it simple, cancer does not respect boundaries. So here is another table comparing normal cells with cancerous cells. The normal cells are colored in blue. As you can see, both normal cells and cancer cells actually divide. That's how our body grows. But as we see here in the drawing, the normal cells divide uniformly. And these are the X chromosomes. So as you can see, they are also very, very organized. So it's supposed to be like that, even in the cellular level, in the most basic building block of our body, everything is organized. Compared to cancer, it's very chaotic, no boundaries. If you look at this clump of, this is actually a mass already. There's a clump of cells which are different in size, and no delineation is observed. So that's one thing to remember. Normal cells, very organized. Cancer, disorganized, does not respect boundaries. But it is important to note that not all kinds of tumors or masses or bukol are cancer. There are also benign types like cysts, which are fluid-filled, and myoma in the uterus. These tumors do not invade other organs and they do not spread to other parts of the body. So benign tumors, they respect boundaries. So as you can see in this picture on the left, they respect boundaries even if there is somewhat kind of an disorganized cells, they are confined. Compared to cancerous, which are very disorganized and they do not respect boundaries. Okay? So that's more or less what cancer is. They are clumps of cancer cells that have no boundaries, very disorganized. Even the genetic material is very disorganized. So why is cancer important? Why are we discussing this right now? Based on the World Health Organization in 2020, data show that 1 out of 6 deaths is caused by cancer. That is 10 million people worldwide. And 1/3 of these deaths are caused by modifiable risk factors. So you can change the course of these deaths if you think about it. But 10 million, it's really hard to imagine. So we should look at our local data. So in the Philippines, this is the data in 2020. This table shows the number of new patients diagnosed with the most common cancers in the Philippines for both sexes. In cancer, we separate males and females because we obviously have different organs susceptible to develop cancer. So for both sexes, the top 5 most common cancers are breast, lung, colon and rectal, liver, and prostate. There are 153,751 newly diagnosed cancer patients in 2020 in the Philippines. But we should take note that this represents only the recorded data, those patients who have access to hospitals. So there are more undiagnosed patients, especially in far-flung areas without access to proper health care. So for males, 67,000 males were newly diagnosed with cancer in 2020. The top 5 most common are lung, colon and rectal, prostate, liver, and leukemia or blood cancer. So we should remember for both sexes and for males it's the lung. So compared to the males, 86,000 females were newly diagnosed in 2020. That's 20,000 patients more than the males. So it's really the breast that is most common. So there were 27,163 new cases. Other common cancers are cervical, colon and rectal, lung, and ovary. In terms of mortality or death, based on the Philippine Statistics Authority, these are the most common causes of death from January 2021 to June 2021. So number 1 is heart disease or heart attack. Number 2 is cerebrovascular disease or strokes. And number 3, we can see cancer is the 3rd leading cause of death, even here in the Philippines. So that is 92,606 deaths caused by cancer in 2020. So now that we know that it is a global and local burden, I think what is important is we know what to watch out for. So what do we have to watch out for? So we will run down the different common cancers and what symptoms can we have. So for the breast, usually we detect breast really early because breast is an organ outside of the body. So if we have a mass, we can easily palpate it as compared to those organs inside the body like the lung, the colon, the liver. Diba? We cannot palpate naman any masses because it's inside. So for the breast, most common is a lump in the breast or the underarms. Lumps in the underarms are usually lymph nodes that are already affected by the cancer. But not all lumps in the armpits are cancer. Sometimes there are swollen hair follicles. So it is important also to know your body. You have to be aware because the main point of looking at the signs and symptoms is knowing what changed in your body. So usually we also observe dimpling of the breast skin. You know the orange peel? That is how dimpling looks like. So we can also observe thickening, swelling, redness, dry, flaky skin, nipple inversion, nipple discharge other than breast milk, such as pus, sometimes blood, change in size or shape, and breast pain. So for the lung, lung cancer, the symptoms are very not specific. Since we are in an endemic country of tuberculosis, sometimes we see patients with the same symptoms. So for the lungs, symptoms include coughing that gets worse or doesn't go away, chest pain, shortness of breath, coughing up blood, feeling very tired all the time, and weight loss with no known cause. Weight loss that is not induced. Or even sometimes lung cancer has no symptoms. So for colon, usually we observe changes in bowel habits, diarrhea, constipation, change in the consistency of stool, blood in the stool, abdominal pain or non-specific discomfort, a feeling that your bowel doesn't empty completely, weakness or fatigue, and weight loss. For cervical cancer, symptoms include spotting in between periods, heavy menstrual bleeding longer than usual, bleeding after sexual intercourse, increased vaginal discharge, pain during sexual intercourse, bleeding after menopause, and unexplained persistent pelvic or lower back pains or discomfort. So for the liver, we also observe weight loss, loss of appetite, feeling very full after a small meal, nausea or vomiting, pain in the abdomen, itching, and yellowing of the skin and eyes or jaundice. For prostate, we usually see urinary symptoms, UTI symptoms, difficulty starting urination, weak flow of the urine, frequent urination, especially at night, difficulty emptying the bladder, pain or burning during urination, blood in the urine or semen, and painful ejaculation. Because the prostate can actually block the flow of urine. So that's why the symptoms are mainly of the urinary tract. So now that we know these symptoms, who do we screen and how? So if there's one slide that's very important, so this is it. This is a very important slide because this shows when to screen for patients who are asymptomatic. Okay, so for this is lung cancer. For lung cancer, we usually screen patients who are 50 years old and above who smoke at least one pack for 20 years. So we do a CT scan of the chest. Okay, so for those of you who know anyone who is 50 and above, who has been smoking one pack for 20 years, we recommend a CT scan of the chest. For breast cancer, we start screening at 40 years old. So for patients 40 years old and above, we recommend mammogram yearly, annually. So sometimes we recommend that you do your checkup on your birthday so you don't forget that it's annual. And then for colon, we start screening at 45 years old. The recommended screening is either colonoscopy or stool testing. Stool testing, we do it usually annually. But if you want a longer duration, you can do colonoscopy, because if you screen using colonoscopy and it's normal, you have to repeat it after 10 years na. So the break is longer. For cervical cancer, we usually start at 25 years old. We do swab test of the cervix. We do human papilloma virus test, because this virus is the one that causes cervical cancer. And for prostate, we usually begin at 45 to 75 years old. It will depend on the symptoms for prostate. No? So for prostate, it's a case-to-case basis. It's not fixed at 45 years old. So the important ones are the lung, 50 years old, the breast, 40 years old, colon, 45, and cervix at 25. Okay. So what are the possible causes of cancer now that we know what to watch out for, when to screen, and how to screen? How do we prevent? So for breast, the breast is a very sensitive organ to hormones. That's why when we have our period, the breast becomes swollen, because it's really sensitive to hormones. So breast cancer is a hormonal kind of cancer. So exposure to hormones such as estrogen and progesterone can make us susceptible to breast cancer. Next is obesity. Why? Because when we are obese, we have lots of fat. And fat, estrogen is made from fat. So that's why we want to advocate keeping our weight normal, because estrogen can be converted from fat. Also, even if our estrogen is normal, we are fit, sometimes our body is genetically really wired to have cancer. For the lung, of course, we all know number 1 is smoking. Number 2 is asbestos exposure. And again, genetics. So for the esophagus, smoking is also number 1. Gastroesophageal reflux disease, those who have hyperacidity, who have chronic hyperacidity, these are risk factors to develop esophageal cancer. Also obesity as well. For the stomach cancer, smoking, Helicobacter pylori infection, this is a kind of bacteria, and also alcohol. So for colon, smoking is also a risk. Processed food such as tocino, the red hot dog, and also genetics. For cervical and oropharyngeal cancer, a risk factor is having an infection with HPV or human papilloma virus. So this kind of virus is acquired sexually. For liver cancer, hepatitis are risk factors. Also, cirrhosis of the liver. So cirrhosis happens when the liver is destroyed by too much alcohol or too much fat. That is from the diet also. So for the skin, exposure to ultraviolet radiation, to the sun. For the urinary bladder, smoking. Schistosoma is a kind of parasite that we can get from freshwater swimming. Aniline dye is dye used in industrial settings. And nasopharyngeal cancer, smoking again, and Epstein-Barr virus. So viruses can really cause cancer. So with this, how do we reduce the risk? So number one is to avoid tobacco use. You know, it's very difficult to actually advocate for our patients to stop smoking, but it is really very important. Actually, it is difficult because even some doctors smoke. So it's hard to convince patients, but usually if they don't want to stop, I just say, just come to me when you already have cancer. Diba? So hopefully they think about it. So as I said, we have to maintain a healthy body weight. Normal BMI is important so that those cancers that are affected by hormones would not develop. Also, a healthy diet with lots of fruits and vegetables. So regular physical activity, which I will expound on later. Try to reduce alcohol consumption. Also, another very important point is to get vaccinated. Vaccination from those viruses that can cause cancer, such as hepatitis, human papillomavirus for the cervical cancer. So that's very important. Also, we advocate getting vaccinated against COVID because COVID is a new virus. So we don't know the behavior of COVID later on. We're not sure if it may progress to cancer. It can be a risk factor to develop lung cancer later on. We still do not know. So it is very important to get yourself protected. So avoid UV radiation for skin cancer. Wear hats, wear sunblock, use umbrellas. Try to avoid the sun during its peak hours. Reduce your exposure to pollution and avoid processed food such as the tocino, the red hot dogs. It's always better to eat the fresh food. So the less processed the food, the better. Okay, so fresh fruits, fresh vegetables, then those processed. So for physical activity, this is actually weekly. So the recommended activity of the CDC is 150 minutes of moderate intensity activity. So this is actually 30 minutes per day, 5 days a week. You can do brisk walking, light yard work, play with children, bike at a casual pace. Or you can do 75 minutes of vigorous intensity activity. That's only 15 minutes per day for 5 days. So that's jogging or running, swimming laps, rollerblading, sports such as football and basketball, and jumping rope. So those are really, if you think about it, 15 minutes a day is not bad to keep your body healthy. So for those with colleagues with cancer, what can we do or how can we relate to them? So for cancer patients, these are the food to avoid. Actually, in general, we do not restrict cancer patients in terms of food unless they are diabetic or hypertensive. But in general, we do not restrict them. There are articles saying that sugar should be avoided, meat should be avoided. Actually, anything in moderation is okay. What we ask the cancer patients to avoid are food that are not cooked because they are susceptible to gastroenteritis. So infection of the gastrointestinal tract. We just want to make sure that the food that the patients will consume are well cooked and clean. So we don't recommend sushi, sashimi, kilawin, soft-boiled or raw eggs, unpasteurized cheese or dairy products, and unwashed fruits or vegetables. So for vegetables, we do not recommend our cancer patients to eat fresh salads. We recommend them to have their vegetables steamed or boiled. And then for fruits, we recommend the fruits with skin, so like banana, so we can remove the skin and we are sure that the food is clean. But in general, sugar, in moderation, it's okay. And cancer patients usually have loss of appetite and their taste buds become different. So if you restrict them more, what else will they eat? Okay. So different treatment options for cancer. We have surgery. Surgery is actually technically, generally, the number one treatment for cancer. However, if we cannot operate on the patient, that's when chemotherapy and radiation come in. So for radiation, radiation, we do it as a targeted treatment. It's just like getting an X-ray, but instead of doing an X-ray to the lung, we target the cancer. So this is a fast treatment, but we do it divided for a few days. Chemotherapy, we have many kinds of chemotherapy now. We have them orally, we have them through IV. So there are many different chemotherapy drugs. They depend. The drugs that we use depend on the cancer as well. And the new trend now is giving immunotherapy or targeted therapy. We now already have studied certain cancers on the cellular level. We now know what to target. Okay, so this immunotherapy and targeted therapy are different from chemo because patients usually do not feel the side effects from chemotherapy. So what are the side effects that we have to watch out for, or we have to look at? So the common chemotherapy side effects, hair fall or hair loss. Chemotherapy, it kills fast dividing cells because as we all know, cancer are fast dividing. So the chemo targets those. However, chemotherapy can target normal fast dividing cells. So what are normal fast dividing cells? Our hair, our nails, our gastrointestinal tract. So usually, that's why we see these symptoms: hair fall or hair loss, nausea and vomiting, stomach upset. We can also have diarrhea or constipation, loss of appetite, and change in taste. Nail changes. We can also have muscle pain, mouth sores or singaw, and generalized weakness and fatigue. So what do we do? What to do? So these are supportive treatment measures that we can advise our colleagues with cancer. So instead of having meals 3 times a day, heavy meals, we can suggest small frequent meals. So we can divide the meals into 6 times a day so that we avoid feeling bloated, feeling nauseous, we avoid the vomiting, and we also help the patient even if he or she does not have appetite. It is good that we support them, especially in eating. And another important measure is to hydrate. I usually advise everyone, not only cancer patient, to hydrate at least 2 liters per day. For those without heart problems, at least 2 liters per day. So that's at least, okay? And for cancer patients who have nausea and vomiting, we already have many supportive medications. We have pre-medications for chemotherapy that is standard. So before, in the movies, when the patient is diagnosed with cancer, the patient is already vomiting, having hair loss. Now, we see less of that because we already have these medications that we give. And then when they go home, we also give them medications that they need or they drink as needed as well. So for some support groups, these are just a few examples. We have Corridor of Hope at St. Luke's Global City. This is an organization, non-government organization with monthly activities. And one activity that I experienced pre-pandemic was bag painting with Heart Evangelista. So they have those kinds of activities. And this one is Kaya Community for young adult patients with cancer. They have an Instagram page, so they have monthly meetings as well. I Can Serve is organization or foundation for breast cancer. And KAIT is an organization for children with cancer, children with leukemia or blood cancer. Okay. So there, we've already finished discussing today's agenda. I hope you learned from this short and concise talk. So with that, thank you for listening, and I'm ready for your questions.
Thank you, Dr. Christina. This webinar is really beneficial for all of us. Indeed, knowing the factors that contribute to cancer can really help us live a lifestyle that decreases cancer risk, and prevention and early detection are more important than ever.
Mm-hmm.
So before we proceed to our live Q&A, let's have the last set of our trivia questions. Again, first one to type in the correct answer via the chat box will win 500 pesos scrap voucher. And the third question is, what are the possible causes for lung cancer? A, smoking, asbestos, polluted air. B, smoking, polluted air, genetics. C, polluted air, smoking, unhealthy diet. And D, smoking, asbestos, and genetics. And the correct answer is letter D. So the winner for this trivia is Mr. T.H. Delros. So for our question number 4, what are the ways to reduce risk of getting cancer? A, healthy diet, 8 hours of sleep, regular physical activity. B, avoid sun exposure, healthy diet, avoid tobacco use. C, drinking 8 glasses of water, regular physical activity, reduce alcohol consumption. And the correct answer is letter B. So the fourth winner is TH Delros. Thank you for joining. So all the winners will reach out to you directly to claim your prizes. And now we are activating the live Q&A box to accommodate your questions for our guest speaker. Please write down your questions in the Q&A box found at the bottom part of your screen. Okay, we will wait for your questions. Let us now start the question and answer. Okay, Doc, we'll just wait na lang for their questions.
We have questions already in the Q&A box.
Okay. So in the Q&A box. So the first question is, why do cancer recur?
So let's say we have already treated the cancer and the patient is cancer-free or is a cancer survivor. That is the thing about cancer. We don't know their behavior because what we know are the organized cells, but the cancers, they spread to distant parts of the body. One possible explanation for cancer recurrence is that there are micrometastasis already in the body that we really cannot detect, that these micrometastasis have already how do you say this, have already is in the body, even if we already did surgery, even if we already gave chemotherapy. Sometimes they can adapt like viruses. They can mutate. They can outsmart us. So that is one difficult thing about cancer. It's hard to completely know their behavior. So they really do recur. That's why we do, after treatment, we do serial monitoring or surveillance. Usually every 6 months, we do scans. That's why when they recur, at least we can treat them early. So that's very frustrating about cancer.
Our second question, Doc, is how can we help a co-employee who has been diagnosed with cancer and currently undergoing treatment?
For this one, we already discussed what we can do, what we can, that we should know the symptoms, how we can help them, our supportive measures by supporting them to eat frequently, small frequent meals, hydration, eat fruits and vegetables that are not fresh. I mean, that are cooked, fresh and well cooked.
Okay, thanks, Doc. So next question is being on remission same as cancer-free?
Yes, we can consider that as being cancer-free. But after treatment, it is really important to do monitoring, really, every 6 months or every 6 to 12 months. It's very important because recurrence is most common during usually the first 5 years after the treatment.
Okay, next question. How much does a cancer treatment
usually cost? Chemotherapy can range from about per cycle, usually per cycle, it's every month. So for chemotherapy, we can consider siguro mga about 3,000 to, let's say, 70,000. That's for chemotherapy. For immunotherapy, the newer drugs, about 50,000 to up to 200, actually up to 300,000.
Next question, Doc. Can cancer be detected by basic tests conducting during annual physical exam?
For annual physical exam, what we check is the breast. So usually we do encounter patients with breast masses, and we request for breast ultrasound and mammogram. And then we also ask our patients for symptoms or risk factors such as smoking, how many years have you been smoking, those things, or if they have cough. So it's really very important to be also aware of your body. So if you detect changes, it's good that you can report it to us so we can guide you to which tests to do.
Okay, thanks, Doc. So is it possible to contract cancer
due to COVID-19? Because I mentioned it. Actually, we don't know the long-term behavior of COVID-19. Viruses, what they do is they irritate our cells. Like, for example, the human papilloma virus for cervical cancer, it irritates the lining of the cervix. So the cervix, what it does is it makes new cells. But since it's really very irritated, the cells become disorganized, they become cancerous. So we do not know yet, but as of now, there are no reports. There are no reports yet for COVID-19 causing cancer.
So this one, Doc, this question comes from employee. Is there a proper process or interval for quitting in smoking?
We can recommend you to a counselor for smoking. We have smoking counselors, psychologists also to help.
Thanks, Doc. So the next question is, when do you say that a cancer patient has already recovered and is
a cancer survivor? Usually we do imaging, CT scans, usually CT scans or PET scan to say if the cancer has recovered. Usually we can say that he or she recovered if we do not see any trace of the mass there. So that's what we do. We do imaging.
Okay, Doc. So next, what are the food that should be limited so as not to increase hormone levels for cervical cancer?
For cervical cancer, actually, cervical is is caused by the virus. For the hormonal, hormonal is for the breast, also for the ovaries. So breast and ovaries parang medyo pareho sila. So actually, just maintaining a normal BMI, that's okay. Anything in moderation.
Okay, thanks, Doc. What is the prognosis of stage 3 cervical cancer?
Well, this one, it depends on the case. Actually, we can see. It will depend on how the cancer will react to the chemotherapy and the radiation. So usually after 3 cycles, we do imaging to assess if it's responsive to the drug, because everyone is different. And as I said, cancer, we don't know the exact behavior of these kinds of cells. So there are cancers, even the same stage, some respond, some do not respond. So we will only know after seeing the response.
So the next question, Doc, is what is the prognosis of stage 2 breast cancer?
For breast cancer, we have many kinds of breast cancer. So if this is the hormonal type of breast cancer, actually stage 2 is pretty early. So in general, breast cancer, since it is detected earlier, it has a good prognosis, especially if we target the kind of breast cancer that the patient has. For breast cancer, we have many treatment options. For hormonal breast cancer, we do tablets.
Mm-mm. Okay, Doc, thank you for that. So the next question is, if you have a family history of cancer, is there vitamins or supplements that can be taken to lower the risk of getting cancer?
For vitamins and supplements, in general, any multivitamins is okay. Also, of course, within the recommended dose, anything sobra is also bad. So any multivitamins is okay. Vitamin C with zinc is okay, especially now with COVID. But for the family history, it depends what cancer and at what age your family or your relatives was diagnosed. So it will depend because sometimes for certain cancers, for example, for colon cancer, usually we recommend screening to first degree relatives of those who have colon cancer around 10 years minus the age they were diagnosed. So if you're, for example, father was diagnosed at 40 years old, by 30, you can already do screening colonoscopy. So that's very important. It's more of the screening and knowing.
Okay, thanks, Doc. So ito naman, Doc, ang same situation ko. So I have a breast lump. I know 1 month ago. I undergo breast ultrasound. The doctor advised to repeat after months to monitor the size po. When or how long do breast lump can be diagnosed as cancer?
Usually, when we do breast ultrasound or mammogram, they have a grading system. If you see the results, you have the BI-RAD scoring. So they will recommend based on the character of the breast mass on ultrasound. So if it's BI-RADS 4 already, or if the mammogram or ultrasound says that it's suspicious for malignancy, that's when we recommend for biopsy. And then sa biopsy, that's where we know that it's really cancer. But if the doctor advised to repeat after 4 months, I think the BI-RAD scoring is probably benign. So we just monitor.
Thanks, Doc. Next one is cancer survival detected on each stages. So may stage 1, stage 2, and stage 3.
It really depends on the kind of cancer because, for example, thyroid cancer, for thyroid cancers, even if it has already metastasized or nagkalat sa different parts of the body, thyroid cancer has a very good prognosis if it's the papillary type, as compared to, let's say, as compared to other aggressive cancers such as sarcoma. Even if it's stage 2, it's really aggressive, fast growing. It doesn't respond to chemo. It doesn't respond to radiation. So it depends on the type of cancer. And for stage 4 cancers in general, when we say a patient has stage 4 cancer, we do not, our goal for the cancer is not cure, but to control, because once it's stage 4, there is no cure, but that doesn't mean na we stop treating, hayaan na lang natin. What we do is we control the disease and make the patient comfortable. If he or she has symptoms, we treat it, we support. So it really depends then on the kind of cancer.
Okay, thank you, Doc. So there's also a question na do metastatic cancer cells undergo a period of dormancy?
Do metastasis. Well, they can while on treatment. They can.
And also, is there an evidence that tomato seeds can cause cancer?
No evidence. No evidence. No studies.
Is food supplement advisable for cancer patients?
Food supplements. This one is a very sensitive topic actually, because usually we receive patients who have undergone alternative medicine, some food replacement, yung mga mangosteen type of medications. Usually, while on treatment, we do not recommend because we don't know if they will interact with the chemotherapy. It's mainly because of that. But after the chemotherapy, after the treatment, maybe he or she can try.
Okay, thanks, Doc. And also, is it risky to undergo a biopsy if unknowingly a lump or mass is cancerous?
This will depend on what kind of cancer as well. If it's breast, well, in general, the gold standard to diagnose cancer is actually biopsy. So it's risky in terms of health-wise. I mean, if you have what do you mean? If you have any heart disease, ganun ba? Or usually we assess if the patient is fit to undergo biopsy, especially if for the lungs, for the liver, we usually do assess.
Siguro, Doc, yung minimi niya yung sa breast mass siguro.
Okay. Ngayon kasi the imaging studies are really good. Yung technology is better na. So it's good that through imaging we can already say if it looks cancerous, it looks benign. So okay naman.
Okay, thank you, Doc. And then the next question is it possible that fibroadenoma reoccur after surgery and become cancerous?
Fibroadenoma, this is for the breast. It can recur, but usually become cancerous. No naman, but it can recur.
Also, when is the best time or age to start getting vaxxed on HPV?
For HPV, as young as 12, 13 years old, you can already recommend getting HPV vaccine, and it's very accessible now.
Thanks, Doc. And how can we extend support to a cancer patient?
Is this in terms of mga financial?
Emotional.
Emotional. Well, mahirap actually na lalo na if they think na hindi kayo makarelate kasi wala naman kayong cancer. So you should just listen to them, and then support if they have symptoms, become aware of what they feel.
Doc, there's also a question. Is there a need to have a booster shot for HPV vaccine?
Usually it's 2 to 3 shots, depends on the brand. After that, no booster in the studies. So those first 2 or 3 shots, they're okay.
Okay, thanks, Doc. And also, for stage 4B cancer, is palliative care better than getting a chemo treatment?
For stage 4B, palliative care, well, it depends because sometimes palliative care can include actually chemotherapy so that we can control the disease. If masyadong malaki yung bukol with what we call palliative chemo, our goal is not to cure but to maybe shrink the mass, to lessen the symptoms. Kasi masakit yan mass. something that is not supposed to be there. Nakaka-compress siya ng ibang organs, nakakairita siya. So, palliative care can include getting chemotherapy. But it also depends kasi on the patient. If the patient is already bedridden, mahina, if we give chemo, mas lalo siyang pwedeng humina. So if kaya niya naman, if walking, active pa, we can consider naman.
Okay, thank you, Doc. Ito din po. If you're undergoing radiation treatment, what can you do to decrease fatigue?
For radiation, you can, number one is to hydrate talaga. No? Hydration is very important. Also, small frequent meals. Pero radiation kasi is toxic din as well. So talagang may side effects because it does not only kill the cancer cells, it can affect then the normal cells.
Also, why do individuals with healthy lifestyles still have cancer?
This is where genetics come in. So there are people really susceptible from their DNA. Meron talagang yung DNA nila, gusto talaga mag-reproduce ng cancer cells. So may mga ganon. We have testing naman available. We do send out to the US yung mga testing, but we do testing na sa mga diagnosed with cancer already. Kasi if we do testing like sa yung walang cancer pa, parang wala pa siyang use. But if usually yung mga may cancer na, we do send the blood specimen usually or tumor specimen in Singapore or US around $4,000 US. Mga ganun yung price niya to check yung genetics. Meron talaga. Sa lung cancer, sa females na East Asian, so tayo yon, never smoker, meron mga lung cancer na ganon, females, never smoker, East Asian. Tapos kapag may genetic mutation na madedetect natin, ang gamot doon is tablets. So marami na ring available treatment options.
Okay, thanks, Doc. And also, what are the best supplements for cancer survivors?
For cancer survivors, any multivitamins is okay. And healthy diet. If you already get your nutrients, vitamins, minerals from your diet, usually there is no need for extra vitamins or supplements. But if kulang talaga yung kain, any multivitamins is okay.
Thanks, Doc. There's also a question, Doc. Doc, my 2 uncles died of colon cancer and the other one died of lung cancer, while my auntie now has recurring breast cancer. Is it possible that we also have it?
It will depend on the age that they were diagnosed. Usually, yung genetics, younger age. So, maganda, you should, when you do your APE, you can mention that so that we can direct your screening. And also we can advise other family members like yung mga cousins mo kasi yung uncle and aunt so actually second degree na. So yung mga first degree relatives, yung important din na ma-screen.
Thanks, Doc. So there's also a question now. How can you avoid the risk of cancer recurrence?
Actually, when you do your treatment, based on the studies, the clinical trials, doon nakalagay per chemotherapy regimen, how long na walang recurrence. So it depends on the treatment. So it's really the treatment that will matter when it comes to recurrence.
And also, Doc, do we get cancer from what we eat?
It can be a risk factor. Like mga preservatives kasi chemicals They can irritate the gastrointestinal tract, the stomach, the colon, the esophagus. They can be irritants. So, pwede. Tsaka yung mga inihaw, yung sunog. Yeah.
Red meat
risk factors din. Lifestyle talaga.
Lifestyle. So, we have last two questions, Doc. Can a change in diet alter the course of cancer?
It's more of the treatment talaga. Kasi iba-iba yung behavior ng cancer per organ, like yung breast. Yung pag breast cancer pa, may iba-iba pang kind. So it depends sa kind of cancer, but yung diet, more of proper nutrition so that the body can actually try to fight the cancer, try to fight the toxicities of chemotherapy. So yun yung mag-help sa course of the cancer. Proper nutrition. So
the last question is, emphysema considered a lung cancer?
No, it's not lung cancer. It's not considered.
Okay, may isa pang humatog. Does paraben in cosmetics or hygiene products
there are no large clinical trials actually to confirm this. So, but in general, walang clinical trial na large enough, no? That's how we say that this causes this, that causes that, based on clinical trials. But I think small studies lang ang available regarding this, so we cannot conclude.
Thank you so much, Docs. And thank you so much to all the people who attended this webinar, and also to those people who submitted their questions. Hopefully, marami tayong natutunan for this afternoon's webinar. We truly appreciate you, Dr. Christina, for giving us your time and sharing your knowledge about cancer, the prevention and treatment. We are looking forward to hear more from you in the near future. So before this webinar ends, we would like to know your feedback on the session. You may click on the chat box below to answer our survey. We hope you will learn new things and had a great session with us. On behalf of Generali Life Assurance Philippines, thank you for joining this afternoon's webinar. We look forward to seeing you again on our next online sessions. We have a lot more in store for you. Once again, I am Dainty May Diabiera of Generali Philippines. Thank you for attending our webinar. Enjoy the rest of your Friday and have a happy day.
We at Generali want to